last December 20th, this was a text message that my wife had sent me at 2:10 p.m., and you can see it's mostly gibberish. And she actually didn't even send it to me. She sent it to my aunt. And anybody who knows me knows I don't text with emojis, so clearly that couldn't be me saying what there. But this text was from my wife. She was sitting in the back of an ambulance in the parking lot of my daughter's school because she was having a stroke. And it was, it was kind of wild. So I'll give you the end cap of it. So the end is she's great. The outcome was perfect. She's very healthy today. At the beginning, though, she was very fortunate. She was helping with a third grade Christmas party. And she was walking out of the school at 2 o'clock. And she was walking with another room mom that was helping with the party. And my wife said she got a little lightheaded. So she said that to the person she was walking out with. And the other room mom just happened to be a ER doc at the Mayo Clinic in Jacksonville. And she said, "You're having a stroke." And she called 911, and she wrote the time on my wife's hands just so she knew exactly when it started happening. And yeah, that kind of set off I guess I would say a 7-month exercise of going through the healthcare system. And for us, been fairly healthy. There's a lot of new experiences for me, new experiences for my wife. And it definitely had its ups and downs. It wasn't, we got a good outcome, but we definitely had our ups and downs. And just so, some of the ups and downs I guess I'll get to, but she had a hole in her heart. I'm sure most people know this, but most people are actually born, everyone I think is born with a hole in the heart. And then 20% of the time that hole doesn't close. And so what happened to her is they believe they had a blood clot that started in her leg, and it had gone up into her heart. And I guess usually in the heart it would break that blood clot up, and that's normal. But she, I guess they think, got unlucky, and she was maybe lifting something out or coughed or was doing something, and at that moment that blood clot jumped through the hole, that little hole in her heart, and it went up into her brain, and then that's what shut off part of her, caused the stroke. So it was quite an experience. And then, some of the ups and downs, this is one from my wife's view, which I find really interesting. So after she was discharged, we got home on Christmas Eve, and she had her follow-up with her primary care on the Tuesday after Christmas, I believe. So it was a couple days after Christmas. And her primary said, "Man, I'm looking through the discharge, and are you sure you had a stroke? Because it's not obvious to me that you had a stroke." And of course, to us, that was kind of wild because, she had, all of everything that happened. It was like, wow, okay, that's kind of that's a confusion and concerning. And it took us down a path of her coming back in and getting more MRIs and more tests. And I don't know if this is normal or not normal, but she ended up having a spinal tap, and she saw an ENT for some different reasons. But we were 3 or 4 months after the stroke, and it's like it didn't feel like we were really making any progress, and it was kind of frustrating. So we ended up changing hospital systems to kind of get a second opinion. And one of the things when we change hospital systems, of course, me, super nerd, background in medical imaging, at least from some of the work we'd done previously. I had every one of our MRIs, every CT, every test we had, I had it on a DVD. And we brought that to the new facility, and when they had done one of the diagnostics, they put the TEE, which as I understand it, it's a thing that goes down into your throat, and it kind of takes a picture of your heart from your esophagus, I think that might be right. And they did that to try to see if they can find the hole in her heart. And that right there is what it's supposed to look like, that flap at the top. That would be the hole. And so she had that TEE done, and when we were getting this for the second opinion, the cardiologist was talking, and he was saying, yeah, I mean, I see the TEE, but nowhere in here can I see the hole because they were off. The imaging was done not looking at the thing that it was supposed to be looking for, the exact thing that it was supposed to be looking for. So, you know, we were going in, or she was going in to get that hole fixed, which is actually pretty neat. They stick what I would describe as it's like a toothpick, like a metal toothpick that has an umbrella that pops out of each side, almost like a cocktail umbrella, and then that pulls together. So they would stick that toothpick through that hole, deploy the cocktail umbrellas, and then suck them together. And that's gonna lock that's gonna keep the hole in place. So what he said is, he's like, look, I don't know, we really don't know if there's a hole, and the best we can do is just go in, and if there's no hole, we'll just call this a bust and try something else. Turns out there was a hole, and they got it closed, and everything ended up good. But a little bit of a frustration. And then I would say this last one to me was something that was incredibly crazy. So when you have that stroke and you're in the ER, and my wife's got the time written on her hand, it's because if you don't get the clot buster in time, then the symptoms might not be reversible. So there was this wild moment when we were in the ER, and I had only been there for maybe 20 minutes or a half hour. And when I got there, I would say that, everybody I think knows the droop of the face. So my wife, the side of her face, I would describe it more as like melting. It was very, she was really in a tough spot. And then she went for an MRI, and I stayed in the room. And she comes back, and it was like, everything is great. Like facially, everything had totally resolved. And it was like, wow, this is fantastic. And the only problem was she had what she described it as double vision, but she said it was actually like if one eye was seeing everything sideways and everything else was normal. So not quite double vision, and that was obviously very concerning. And the doctor it was a TV was wheeled in, and the physician was on the television screen, and he was saying, which is crazy to me because this is probably literally the most important decision my wife has ever made in her life. He says, I guess you could use a matrix reference. It's, you get the red pill or the blue pill. This will probably resolve on its own, and then everything's great, you'll go back to normal. Or you could take the red pill, and there is a 5% chance your minor stroke is going to be a major stroke. And very, very, again, like I said, probably the biggest decision my wife had to make. And I was, if it's me, I was like, I'm not really I am a risk taker, but not with my wife. So I would say, I don't want you taking that pill, I think but she was with it, and she's a pharmacist also. And so she wanted that. She knew, she knows enough about the drug, and she's like, let's go, let's do it. And then, of course, we got the outcome we were looking for 7 months later. But really for me, it was just, it's so interesting because I look at this, and it's like, I get a little frustrated because we've got so much great technology and so much capability. And, I look at this, and I just feel like that whole experience from, maybe some QC on that chart as far as, hey, do these notes match what happened? On the imaging front, we have technology on imaging to help us understand what we're seeing in these reads. And this technology is to the point where it's really, really good. And, when it gets to this, the communication of this will probably resolve on its own, that's a major decision. And I would like to understand this 5% chance. Is that conditioned on everything you know about my wife, her age, her, what we were seeing, her demographics, or is this just a general population metric? So I think healthcare it's in a spot where it would be great to have an AI co-pilot, something And I don't just mean on the provider side, I also mean on the patient side. When we were switching healthcare facilities, I had all that imaging. I would love to be able to put that into an assistant to help me get a reread on what was or wasn't in all that data. So I'm excited for this. I think there's a lot of opportunity coming. So now we're gonna, I hope that wasn't too much of a downer, but I feel like it was to me, it was kind of eye-opening with what we hear about what's happening versus what you might experience today.